I am Petra Erving. I suppose you would call me a specialist bodywork therapist. I'm predominantly a lymphedema therapist, but I also do myofascial work. Predominantly, so I would say probably 95% of the patients I see are breast cancer related. I have a limited number of primary patients, which are legs, but the majority are breast cancer. I mean, immediately it sounded complementary to my treatment. So where I was doing a lot of, you're going into the tissues and trying to break down or separate any fibrosis, by using this in conjunction with that, then it's lifting the tissues and vibrating, which is also separating the cells and the tissues. So, I mean, straight away I thought, that's the one for me. Particularly when I do bandaging, so when you're doing the decongestive therapy, GLT, it's the outcomes for me are massively enhanced. I use it probably in all patients actually. A lot of the so irradiated tissue that you don't want to put too much pressure on, you can use the light setting on that. I would probably use it on most patients. So I generally start off doing an MLD session, so it's normally starting off with a neck treatment, opening all the pathways. We'll do the arm as well, lots of deep breathing, and then use the PhySIQUIPE, and then finish off with flushing out the tissues afterwards. Patients love it. They initially think, oh, that feels a bit funny, but I think they find it quite relaxing because I do it as sort of, they have 4 suctions in one area, and then I go, so it's a wee bit hypnotic, I think, for everybody, and they notice the benefits straight away. Softer tissue, better movement, better tissue movement. It just makes them feel better. There's a lady that I don't see her any longer, sadly, because she was an NHS patient, but she had lymphedema for 50 years, primary lymphedema, hadn't had good quality care. She was so small, and because her leg was so big, I didn't want to do 4 weeks of treatment or any longer than that, because it's a lot of weight she's carrying around as it is. So we did it in blocks of 2 weeks of treatment. And I mean, she wrote a testimonial saying that she'd never had an outcome like it before. So it was just the combination of that. I mean, I predominantly used that, hardly used my hands at all because the tissues were so engorged and really hard. She'd had numerous bouts of cellulitis, and got her leg down to probably half what it was. She'd stopped having cellulitis. So for her and for me, it was a massive, brilliant outcome. So I've never been into equipment. I always thought that if you can't do it with your hands, you can't do it properly, because you're feeling, you're palpating as you're working, So I've never been a person for technology or equipment, but this definitely fit in with my treatment ethos. It did take me totally away from using any gadgets. So yes, this changed my mind on using equipment.